Hawaii Medical Center is laying off its second wave of employees after issuing pink slips to 500 employees a week ago, just 2 days before Christmas. Tonight, the two hospitals are expected to announce laying off more employees a couple of days before New Year's. New tonight at 6, KITV4's Kyoki Kaur here with the latest on how the city's ambulance crews are gearing up with extra staffing for New Year's Eve because of that hospital shutdown. Kyoki?
Well, Laura, a spokeswoman for the two bankrupt hospitals told us earlier today the facilities expected to announce another round of layoffs today, but as of now, HMC has not released details on how many more employees are being let go. As HMC East in Liliha prepares to close, HMC West in Ewa closed all of its patient wards earlier this week. A Hawaii Medical Center spokeswoman had some good news for out-of-work hospital employees. The spokeswoman told KITV4 News that former HMC staff will be eligible for COBRA, allowing them to continue getting their health insurance if they pay a monthly fee. The hospitals had previously told some of their unionized employees they would not be able to get COBRA coverage.
And then any serious bleeding right now.
At the city's ambulance dispatch center today, this electronic billboard told the story. The emergency rooms at both HMC hospitals are permanently closed. And because of that, other ERs are extra crowded. So they're listed as temporarily closed because they're full. The city has already added 2 extra ambulances and personnel to help ferry patients, especially from central Oahu, after the 2 hospitals closed their ERs 2 weeks ago.
It's given us a challenge to keep coverage in the area because now the ambulances have to go out farther. They go as far as either Wahiawa, Palimomi, or even to town.
New Year's Eve is traditionally paramedics' busiest night, along with Halloween. So the city always adds a couple of extra ambulance crews on duty. But because of the HMC ER closure this year, the city is adding several more crews in the field tomorrow night.
We're certain we're going to have probably more than adequate coverage by adding holding shifts over, keeping some of the 16-hour stations open.
So 3 ambulance stations that normally go off duty at 11 p.m. will have extra staff to work the overnight shift.
Only his arm appears to be injured right now.
Extra ambulance dispatchers will also be on duty.
They're multitasking on a day-to-day basis, but it's kind of like amped up on New Year's.
Now, city ambulance officials say on an average evening, they handle anywhere from 25 to 40 calls on Oahu, but on New Year's Eve, they can respond to more than 100 calls. But they say the call volume has decreased over the last few New Year's Eves as fireworks restrictions have increased. Laura, back to you.
Let's hope they get some kind of a break. All right, thanks a lot, Kyoki.